Hello everyone, today I'll be presenting on type 1 diabetes, an autoimmune disease that affects how the body regulates blood sugar. I chose this disease because someone in my family was diagnosed with type 1 diabetes, which made me want to learn more about what causes and how it affects the body and how people manage it every day. During this presentation, I'll be explaining what type 1 diabetes is, discuss its symptoms and risk factors. I would also describe the psychological changes that occur in the body. I will also review the diagnostic test used to identify the disease and explain why raising awareness is important. The purpose of this presentation is to provide an overview of type 1 diabetes and explain how it affects the human body. I will begin by explaining that the disease is and how it develops. Next, I will describe the common symptoms and discuss the major risk factors. I will then explain how the destruction of insulin producing cell changes normal body function and leads to the symptoms people experience. After that, I will review the tests doctors use to diagnose type 1 diabetes. I will also discuss who is most likely to develop the disease and explain why education and awareness is important. So type 1 diabetes is an autoimmune disease. Normally, the immune system protects the body from bacteria and viruses. However, in people with type 1 diabetes, the immune system mistakenly attacks the insulin producing beta cells located in the pancreas. As more of these cells are destroyed, the pancreas produces less and less insulin until little or none is left. Insulin is a hormone that allows glucose or sugar to move from the bloodstream into the body cells, where it is used for energy without enough insulin. Glucose builds up in bloodstream instead of entering the cells, causing high blood sugar because damaged beta cells cannot regenerate. People with type 1 diabetes require lifelong insulin therapy to survive. Signs and symptoms is frequent urination, excessive thirst, fatigue, weight loss, hunger, genetics, and viral triggers. As in my case, my cousin had an extreme weight loss, and apparently it was in the genetics. So for this slide, the symptoms of type 1 diabetes develop because the body can no longer move glucose into the cells efficiently. One of the first symptoms is frequent urination because the kidneys try to remove excess glucose through the urine. As more water leaves the body, people become extremely thirsty. Even though glucose is present in the blood, the body's cells cannot use it for energy, causing fatigue, increased hunger, and weakness. Since the body cannot use glucose properly, it begins breaking down fat and muscle for energy, resulting in unintended weight loss. Unlike type 2 diabetes, the main risk factor for type 1 diabetes are genetics, family history, age, and possible environmental triggers such as viral infections. Lifestyle choices such as eating too much sugar do not cause type 1 diabetes. This is now the physiology and healthy blood sugar regulation of type 1 diabetes. To understand type 1 diabetes, it is important to understand how blood sugar is normally regulated. After we eat carbohydrates, as some people might know just the word carbs, they're broken down into glucose, which enters the bloodstream. In response, the pancreas releases insulin. Insulin acts like a key that unlocks the body cells, allowing glucose to enter where it can be used to produce energy. As the glucose leaves the bloodstream and enters the cells, blood sugar returns to a healthy level. This process happens continuously in a healthy person and helps maintain normal body functions. For the physiology, type 1 diabetes. In type 1 diabetes, the immune system destroys the beta cells that produce insulin. Without insulin, glucose cannot enter most body cells and instead remains in the bloodstream, causing high blood sugar levels. Although there is plenty of glucose available, the body cells are unable to use it for energy. As a result, the body begins breaking down fat and muscles as an alternative fuel source. This process produces substances called as ketones. If ketones build up too quickly, they can lead to diabetic ketoacidosis or DKA, which is a medical emergency. DKA can cause nausea, vomiting, abdominal pain, confusion, difficult breathing, and even loss of consciousness if left untreated. This physiological process explains why people with type 1 diabetes can lose weight even though they're eating normally, and why insulin therapy is essential for survival. As shown in the photo, we got the stomach, pancreas. Once the food falls into the stomach, it converts food to glucose. Glucose then enters the bloodstream. After that, the pancreas produces sufficient insulin, but it is resistant to effective use. Glucose then becomes unable to enter the body effectively, and then the glucose level increases. Diagnosis. Doctors use several tests to diagnose type 1 diabetes. A blood glucose test measures the amount of sugar currently in the blood. An HbA1c test measures average blood sugar levels over the previous 2 to 3 months by examining how much glucose has attached to red blood cells. Autoantibody test helps determine whether the immune system is attacking the pancreas, which helps distinguish type 1 diabetes from type 2 diabetes. A C-peptide test measures how much insulin the body is producing naturally. Low C-peptide levels indicate that the pancreas is producing very little insulin, which supports a diagnosis of type 1 diabetes. This image shows 4 different type of laboratory tests with a brief description of what I also mentioned that it measures. Prevention and who is affected. Currently, there's no proven way to prevent type 1 diabetes because it is caused by autoimmune response rather than lifestyle choices. The disease is most commonly diagnosed during childhood, adolescence, and early adulthood, although it can develop at any age. Both males and females can develop type 1 diabetes, and it occurs in people of every race and ethnic background. While having a close family member with the disease increases the risk, many people diagnosed with type 1 diabetes have no family history at all. Early diagnosis is important because prompt treatment can prevent serious complications and improve long-term health outcomes. For my conclusion, type 1 diabetes is a lifelong autoimmune disease that prevents the pancreas from producing enough insulin. Although there is currently no cure, the disease can be successfully managed with insulin therapy, healthy lifestyle habits, continuous glucose monitoring, and regular medical care. Advances in technology include insulin pumps and continuous glucose monitors have made it much easier for people with type 1 diabetes to manage their blood sugar and live active, healthy lives. Learning about this disease has helped me better understand the daily challenges faced by people living with type 1 diabetes and why early diagnosis and education are so important.